Prostate cancer often goes undiagnosed, and joining me with what you should know is Dr. Brian Lee from Meriter. Good morning.
Hey, good morning. Thanks for having me.
It's our pleasure. So how common is prostate cancer?
Well, prostate cancer is one of the most commonly diagnosed prostate cancers in men, and 1 in 7 men may face it during their lifetime.
Now, how does prostate cancer compare to other cancers?
Well, I would say prostate cancer is probably, as an issue, is most similar to breast cancer, being the #2 cause of cancer death. Breast cancer in women, prostate cancer in men, and about 30,000 men die of prostate cancer every year.
Now, what are some of the symptoms for prostate cancer?
Well, unfortunately, early prostate cancer doesn't have many symptoms. Some symptoms can be blood in the urine, can be change in urinary symptoms, but some of the later symptoms are things like back pain, bony pain, weight loss, things like that. So some of the best ways to detect it early is to just get checked by your doctor.
And what are some of the things that you should ask your doctor if you are getting checked?
Well, certainly if you have a family history of prostate cancer that runs in the family, you should mention that, mention any kind of changes in urinary symptoms, and just mention if you've had any abnormalities in PSA testing, which is a blood test that we use.
Now, if there are no symptoms, how is prostate cancer detected?
Well, prostate cancer is detected based on kind of the risk factors, some of those things like family history, enlarged prostate, PSA, things like that. But probably the best way it's detected is use of an exam as well as the PSA blood test.
Speaking of the exam, what age should you start the screening process?
Different cancer organizations recommend different ages, but the one that I use is probably more the American Cancer Society, which is starting at age 50, and if you have a family history of early prostate cancer, a little earlier than that.
Lastly, how is it treated?
Well, there are many different ways for treatment. Treatment has very high cure rates, in excess of 95, 98%. But there's surgery, robotics and open, there's radiation, there's brachytherapy with seeds, and those are some of the main treatments.
Where can people find more information about prostate cancer?
I recommend the American Cancer Society. They have it's cancer.org. They have a pretty balanced view on these cancer issues, and a lot of cancer experts contribute to those recommendations.
Dr. Brian Lee, thank you so much for coming in this morning.